This skill is designed to evaluate your ability to provide spinal immobilization to a sitting patient using a half-spine immobilization device. You arrive on the scene of an auto crash with an EMT assistant. The scene is safe and there is only one patient. The EMT assistant has completed the scene survey as well as the primary assessment, and no critical condition requiring any intervention was found. For the purpose of this evaluation, the simulated patient's vital signs remain stable. You are required to treat the specific isolated problem of a suspected unstable spine using a half-spine immobilization device. You are responsible for the direction and subsequent actions of the EMT assistant. Transferring and immobilizing the simulated patient to the long backboard should be described verbally. You have 10 minutes to complete this skill. Do you have any questions? I have no questions.
You may begin.
The scene is safe and I have on my PPE. I'm going to ask my assistant to please hold the patient's head in a neutral inline position and maintain it. I am then going to check PMS. I'm checking pulses bilateral and they are present and normal. I will check movement. Can you wiggle your fingers? And sensation. What finger am I touching?
Index.
I'm now checking the pedal pulses, bilateral, present and normal. Can you wiggle your toes? And what toe am I touching?
Big toe.
I'm now going to measure for the cervical collar. Apply that measurement to the collar, and then I will adjust. And then I'll place it. And then position on the patient. Can you open your mouth? Okay. We'll now position the patient to place the device. Move the patient forward on the head's count of 3.
1, 2, 3.
And please hold. Okay, if you could please put your arms up. And on head's count, we will move the patient back.
1, 2, 3.
Okay. Now I'm going to place the chest straps. And now I will tighten the torso. Could you take a deep breath and let it out? Deep breath, let it out, and a deep breath and let it out. And I'll check to make sure that we are not constricting the chest. I'm now going to secure the hips. Are any adjustments necessary? Roderick.
I don't think so.
Okay. And I'll secure and tighten the hip straps. Okay. Now I'm going to measure and apply padding between the back of the head and the device, and ask my partner to continue to hold C-spine. Okay, C-spine can now let go. I'm going to place my patient onto a longboard, and then I'm going to recheck pulse present and normal. Can you wiggle your fingers, movement, and sensation? What finger am I touching?
Index.
And I'll also check the pedal pulses. Present and normal. Can you wiggle your toes? What toe am I touching?
Big toe.
I am done with this station.